It began as a pain, not the kind that stops you in your tracks, the kind you explain away. Chest discomfort, pressure, a pain that moved unhelpfully between places. The kind of pain that sounds familiar, dangerous in its familiarity. He was active, fit, still working, still performing. This was not someone the word emergency seemed to belong to, and yet the clock had already started. On that day, the symptoms didn't arrive all at once. They escalated slowly enough to invite doubt. Was it indigestion? Muscle strain? Stress? By the time he reached medical care, the assumption had already formed. Because when a middle-aged man presents with chest pain, the most common answer rises to the top: heart attack. Treatment followed the assumption: pain medication, testing focused in one direction. But something else was happening, silently, rapidly, and catastrophically. This was someone known for movement, physical comedy, timing, falls that looked painful but never were. Someone whose body had always been part of the performance. He made audiences laugh without cruelty. His humor was generous. Even when the characters were chaotic, there was warmth underneath. This was not a fragile person. This was someone who trusted his body. And that trust, earned over a lifetime, can make warning signs easier to dismiss. When what he was experiencing was not a heart attack. It was an aortic dissection. The aorta is the body's main artery, thick, powerful, built to withstand pressure. But sometimes a tear forms in its inner wall. Blood forces its way between layers, and the artery begins to split from the inside. The pain can feel identical to a heart attack. Chest pain, back pain, jaw pain, shortness of breath. But the treatments are not the same. In fact, some standard heart attack medications, particularly blood thinners, can make an aortic dissection far more deadly. This is where time matters, minutes matter, and assumptions matter. After his death, physicians began talking, quietly at first, about how often aortic dissections are missed, especially in patients who don't look like textbook cases, especially when symptoms overlap with more common diagnoses. Emergency medicine began emphasizing one critical question: what else could this be? His case is now taught in medical schools, not as a failure, but as a lesson, a reminder that familiarity can be dangerous, and that rarity does not mean impossibility. The patient was John Ritter. He was 54 years old. He did everything right. He sought help, and still, the diagnosis came too late. John Ritter didn't just leave behind performances. He left behind a warning and a change. Today, awareness of aortic dissection is higher because of his story. More clinicians pause. More patients ask questions. More lives are saved in the space between symptoms and certainty. You knew the name. Now you know the diagnosis. But what matters most is the space in between, the moment when the story became human again. This has been Behind the Diagnosis, Famous Lives Untold. The life you knew until the diagnosis. And I am your host, Zoe Michaels. Until next week, be well.